tell me what test you need, Vangelis, in this patient? What test you will prescribe? What?
Excuse me?
What test you will prescribe for this patient? What do you require for it?
I couldn't hear it last time you mentioned it, but I couldn't hear it.
Okay, forgot what I have told. If such a patient comes to you, what test you ask the nurse to do?
Blood count?
Yes, you see, it's simple. Blood count. And you have hemoglobin 105. Is it normal? 105.
Yes.
It is normal. What was the average of the hemoglobin?
I don't
You don't know. Is it normal, Georgi? Is it normal, Christopher?
Not sure.
Albert, can you tell me the average of the hemoglobin?
No.
Yes. And 120 up to 160. So the patient has anemia. You see, you have seen her that she's pale. So we discussed that the patient has anemia. And I tell you that it's 105, even if you don't know the normal range. I said, yes, it's normal. You see, you have to think. Okay, now red blood cells are 3.33, and you have tell me 3.33 the red blood cells, and you tell me it was 3.5 the range, so they're also decreased, and the hematocrit is 0.33, we know it's 35, so it's also decreasing, slightly decreasing but decreased. And we have white blood cells 4.11. What does this suggest? White blood cells 4.11. Are they normal?
Yes.
They are normal. Near the lower range, but they are normal. And the platelets is 460. Yes, a little bit increasing. So, yes, 460. They are increasing. It happens in tumors and it happens in inflammation. So, this increased level of thrombocyte suggests that the patient has some tumors. You know, in most type of the leukemia, at the early stages, they are increasing, and later they are decreasing. However, when you ask why the patient has bleeding from the gums, no way, you have to check it. Now, we say the other test, and the sedimentation rate is 10 millimeters. It doesn't correspond in blast leukemia, what we expect to increase. Here is absolutely normal. Unless the patient is treated with corticosteroid. This is 27. Yes, she was treated because it's 27th of March.
Okay.
And LDH is also normal. So most of the tests, however, are normal. Probably a little bit. What will be actually the test which we need to prove the diagnosis? Now, Panagiotis, what test we need to prove the diagnosis in patient with blast leukemia? What?
Smear
From
bone marrow.
From bone marrow, yes. We need it okay, we see the first test. Hemoglobin was 90. The left side was 7.5 increase. So we see before the treatment the results were completely different. And we have 49% blast cells. And it was not in the bone marrow, it was in the peripheral blood. So you see, it was a really severe form of blast leukemia. Now, you don't forget, and the thrombocytes, the platelets was 19.
What?
So 19. You see how much they were decreasing. That's why she was having bleeding from the gums. It's very low, 19. You need to be over 140. Actually, when they are 19. Okay, and you see the patient has performed all other tests for hepatitis B, C, HIV, Wassermann, to see some infection which may be predisposition factor for the virus. And actually, the leukosis is a very, very severe one. It is M2, it means neoblast leukosis. It means the neoblast, the most early myeloid cells. They have malignized it. So it's a really not very good prognosis here because it's a very bad type. And here it was made from the bone marrow. In the bone marrow, we have 37.5% plus cells. Again, too much. And they have made a phenotype, immunophenotype, but it's not so important. Yes, and it is the same. We will do the same. So there, now what is the cause actually? It was found out. It is genetic mutation. Genetic mutation. What is causing this genetic mutation? It happens in the cells. We don't know. It may be some contact with toxicity. Maybe we don't know.
But
Maybe
like,
something from the food. Maybe we don't know what.
she didn't have any predisposition, right?
She has no genetic, but something has caused this mutation of the genes. So it was found here that she has this gene mutation, which was causing actually that. At least she doesn't know it to come from her parents, so we believe that this is gene mutation. It's some extrinsic factor which was causing this mutation, but we don't know what it is. Actually, we don't get any. So, from the other, yes, she was treated with cytostatins and the bloods were reduced to 20%. Now she feels better. Okay.
Γιατί είναι ευαίσθητες
I
πιθανότητες
wouldn't
για
take
κυρίως
more of
σήμερα.
your time for today. Let's see what happens. For the next time, please read the diabetes and then we try to finish at least 1 hour before the normal time so you will have time to do the test. Okay. Have a nice day.